안녕하세요. 진쌤 한국어입니다. Hello, welcome to 진쌤's Keep It Up. So today we're on chapter 3 of the 기초 book. And chapter 3, today we're only going to do a one part at a time. Okay, so chapter 3 is about 국민의 건강과 안전. It is about health and safety. Okay, so first part, we're going to talk about the system. It's for the health related. So about all the facilities for the medical care, and then Korean medical care system. Okay, so first, 국민의 건강을 위한 제도에는 무엇이 있을까? 의료기관 이용 방법. So this is about how to use the healthcare center. Okay. Healthcare center. 자, 한국의 의료기관은 규모나 이용 서비스 범위에 따라 구분된다. 자, 한국의 의료기관은 so the Korea's healthcare center it can be divided depending on the size or 이용 서비스 범위. So service coverage. Okay, so 가벼운 증상이 있거나 간단한 검사를 할 경우 동네 의원이나 보건소에 간다. So here, first place, we're talking about 동네 의원 or 보건소. 보건소, it's like a clinic, small clinic. 동네, like the town hospital, like a small town hospital. So, in what case? If you're just doing a simple, easy examination, and that's where you go. 병이 낫지 않거나 정밀 검사가 필요할 때는 종합병원이나 상급 종합병원에 찾아간다. So 병이 낫지 않거나, so your disease, whatever health problem that you have, it has not get well, or if you need a complete medical examination, 정밀 검사, complete medical examination, when you need it, then that's the second part. 종합병원이나 상급 종합병원. So 종합병원, it will be the general hospital. Okay, so 종합병원, you go to the general hospital, or 상급 종합병원. 상급, it's a little bit above the general hospital, which is like the university hospital. Okay, 이 밖에 한의원에서 침이나 뜸을 이용한 치료를 받고 한약을 처방받기도 한다. So the other type, it's 한의원, Oriental Medicine Clinic. So if you go to Oriental Medicine Clinic and you can get the treatment by using 침, acupuncture, or like thym, 목사, and 한약을 처방받기도 한다. You can also get a description for the 한약, the Oriental medicine. Okay, so this is the types of hospital that you have to remember. The first one, it's 의원 and 보건소, and second, it's a general hospital, and then third, 상급, it's more of the university hospital. Okay, so 3차 병원에 갈 때는 when you go to the 3차 병원, 1차 병원의 진료 의뢰서를 가져가야 한다. So 진료 의뢰서, it's like the medical treatment request. Okay, medical treatment request. So you have to take the medical treatment request from 1차 병원 or 2차 병원. So this is the 침 acupuncture. 한의원에서 at the Oriental medical clinic, and you can get the treatment or you can also get the medicine there. Okay, so this is the 4 steps. 진료부터 약 구입까지. So the first step is register. Okay, the first step, you have to register for medical treatment, and then your name, address, and contact information, 주민등록번호, or 외국인 등록번호. So 외국인 등록번호, your alien registration number. Then the second step, it's actually you just to get the treatment. Okay, to get treatment, which is that you go see the doctor, talk to the doctor, you go to the room and get the treatment. And the next step, it's the payment. After that, after seeing a doctor, you have to make a payment there. So 진료비 계산 및 처방전 받기. 진료비 계산. So you have to pay the 진료비, medical expense. And then get the prescription. 처방전 받기. And the last step is your visiting where? Pharmacy. 약국 방문. Go to the pharmacy. 내 약국에 처방전을 내고 when you go to the pharmacy, you have to give them the prescription and you purchase the medicine. So that's the 4th step in Korea. Okay, all right. So next one, 국민건강보험. So this is the national Korean national health insurance. Okay, 국민건강보험. 사람들은 살아가면서 갑작스러운 사고나 질병에 걸릴 수 있다. People, when they are living, right? So there is a chance that you get the sudden accident, 갑작스러운 사고나 sudden accident, or you can get sick. 질병에 걸릴 수 있다. 자, 한 번에 치료비가 많이 드는 경우에는, so in case, like if it costs a lot to pay the medical bill at once, 경제적으로 어려움을 겪을 수 있다. You can, there is a chance that you can having a difficulties financially, right? Financial difficulties, right? So 이에 대비하기 위해, so in order to prepare for this, 한국 정부는 국민에게 매달 일정 금액의 보험료를 내도록 하고, so in order to prepare this, the Korean government have the public pay the insurance fee like every month, 일정 금액, a certain amount, and then 필요에 따라, and depending on the need, 치료비의 일부를 지원해주는 국민건강보험 제도를 운영하고 있다. So they are running what system? They are running the National Health Insurance System, which is they can support the treatment bill, or the part of the medical bill, depending on the need. depending on the need. 자, 한국에 6개월 이상 체류한 외국인, 재외국민은 건강보험에 가입해야 된다. So if you are a foreigner or foreign national who are staying in Korea over 6 months, then you have to get the insurance. Then you have to get the national health insurance. So this part, the part that you have to remember, it's that the Korean health insurance, and they also have the system for foreigners and the foreign national people. Okay, so 생애 주기별 건강검진, the health checkup. 건강검진, health checkup, 생애 주기별, the life cycle. So depending on life cycle, health checkup. So for the infant, 영유아기, so the age of 0, between 0 and 5. And then 학령기, it's for school age. For school age, between 9 and 18. These are the teenagers. And then 성인, the adult or the old age. The old age. So who is over 20? And then there are two different types. One, it's the a general health checkup. The second one, and then the country, like the cancer checkup. Okay. So, 건강보험에 가입하여 생애 주기별 건강검진을 통해 질병을 미리 예방할 수 있다. So you can prevent the disease through this life cycle checkup after you have the health insurance. Okay, 자, 4만 원으로 코로나19 치료 가능. So this chart is showing, so 건강보험공단, it's the health insurance corporation. It's the health insurance corporation. They actually pay 80%, and the government pay 20%. Government and the self-government. So that's why the total medical bill is almost $1,000, but the amount that you have to pay, it's only 4만 원. Okay, so 건강보험 제도의 운영으로 due to the running this the national health insurance system. So when the COVID-19 happened, and it was possible to for people to get the checkup and get a treatment. Okay, so last part. 처방전 없이 살 수 있는 약이 있다고요? Oh, is there a medication that you can buy without prescriptions? So here, 가벼운 증상 있을 때, when you have just like light symptoms, when you just have the light symptoms, 처방전 없이 가까운 편의점에서 약을 구매할 수 있다. Without prescription, you can actually buy the medication at the convenience store. 자, 구매 가능한 약은 the medication that you can actually purchase it is 해열 진통제, the cold medicine. It's about the fever medication, and the cold medicine. And then 소화제 is for digestion, and this is the patch. The pain relief patch. Okay, but these are something that you have to know. So you got to make sure how to take the medication and the quantity. And then 12세 미만 어린이 혼자서는 구매할 수 없다. So if you are under 12, then you cannot buy it on your own. 아이들이 손에 닿지 않는 곳에 보관한다. You gotta make sure that you have to keep this medication where the children can't reach. Okay, So that was it for the first part. Okay, so make sure you remember about all different types of the hospital and the Korean medication, Korean healthcare, health insurance system. Okay, and for the next one, we are going to continue for the second part. Okay, 감사합니다.